It's Dr. Cassie Smith, and welcome to Back to the Basics, a simple approach to health in the modern world. I appreciate you taking the time to join me today and hopefully learn ways that could help you improve your health. The modern world has left little time to focus on health and wellness. I hope to give you some quick and simple ways to be well and live your best life. Hello, welcome to this week's episode of Back to the Basics. I'm glad that you joined me in continuing on your journey of health, learning things that just go back to the basics and make you a healthier person. Today, I'm super excited about my guest. Her name is Buket Tinoki. She is a certified family practice practitioner with over 7 years of nursing experience and 4 years as a nurse practitioner. I met her on Instagram through somebody else that I met on Instagram. She's fluent in Spanish and Turkish. She specializes in bioidentical hormone replacement therapy, aesthetics, integrative medicine, and wellness. Buket's diverse background includes specializing in GI health, pulmonary care, primary care, and mental health. She believes a holistic approach targeting mind, body, and soul to achieve whole body healing is her approach that she uses. She's dedicated to enhancing the quality of life and helping people thrive through comprehensive integrative care. So please help me in welcoming her to Back to the Basics.
Thank you.
So we kind of met through social media. I think that you do great social media reels. You're kind of learning hormones and just gut health and kind of doing the same things that I do. And so tell everyone, I guess, a little bit about where you are, what you do, how long you've been doing it, because I know, so you've kind of started your own practice recently, which I love, female entrepreneur. And you're killing it already and you're super busy, which I knew you would be. So tell everyone kind of a little brief background about you. And then we're going to talk today, you guys, about the gut because she got me super interested in the gut. So we're going to talk about that.
Yay. Yes. So yes, I am located in Atlanta, Georgia, Alpharetta, Georgia in particular. And my passion started back way before I was even a nurse, with my kids, reading books and learning about nutrition and health and just natural remedies. And I got really into that and geeked out on it like as a, patient kind of, and then went to nursing school. And in nursing school, I absolutely loved the gut because all the books and all the stuff that I read beforehand was about gut health. And you're only as healthy as your gut is, and you can only absorb as much as your gut allows, to. And so I remember sitting in the front row of the class in nursing school, and I'd raise my hand and ask questions. And I remember the teachers would say no, you just follow kind of the orders, don't go too deep. And I always wanted to know why, why, and how can we fix it? How can we get to the root cause and fix it, the problem? And, a lot of it's in the GI gut, in the GI tract and in the gut and probiotics, this and that. And my teachers were just like, Buket, focus on nursing and being a nurse. So I knew then I had to go to NP school to then learn all these other things to actually provide care and help patients. And so I went on to nurse practitioner school. And as you know, in allopathic medicine and traditional medicine, they kind of teach us the basics, which is very important because I do believe there's a time and place for that type of medicine. But we weren't really taught a root cause too, why is it happening? We have all these Band-Aids. And so I went into the rabbit hole, taught myself a lot of things, took some extra training and courses and really delved deep. And, when we're trained in school, I do believe they give us the tools to advocate for ourselves to learn more. And I do believe medicine is an art, and we all can do things in different ways and create plans for our patients. So went to school, did all that, and dabbled into GI as a nurse, dabbled in mental health and in psych, and I absolutely love that because I do believe there's a connection, and landed in kind of all things because I also enjoy aesthetics. So marrying them all together, and currently in my practice, I see hormone patients, females in perimenopause, even PMS, PMDD, menopause care, men's health, TRT, longevity medicine, aesthetics, and then, of course, gut health. So I do all of it, and I enjoy all of it.
Okay. So I love that. And that's why I'm excited that you have this practice. So if you guys are listening anywhere near Atlanta, you need to find her because she's awesome. And she does really fun social media reels. I laugh hysterically at a lot of her reels. But she, you know, her and I were kind of talking, and I've always been very interested in gut health, but she got me really interested in it several months ago. And she's kind of been helping me along the way find the right like tests to do and the right people to talk to so that I can provide really good gut health to my patients. And so, you know, her and I, we both have talked about this. We believe that you can't really be well if your gut's not well. And I've always said this about the thyroid, right? So I've been doing lectures for BioT for, I don't know, 2 years now. And I tell people it is impossible for your thyroid to be healthy if your gut's not healthy, right? And so I lived in this world of like, you should take a probiotic and be good to your gut and not eat all these bad things. I've lived in that world for about 3 or 4 years. But I will tell you, you know this, that even though you live in that world, you still have people that have symptoms, right? So you still have people that have diarrhea and they have constipation and they have abdominal pain and they're bloated and they have heartburn and they're tired and everything else looks normal and they don't know why they're tired. And so, you know, you and I were talking, and as I do more and more research, we know that 70 to 80% of your immune system lives in your gut. Well, if you have a terrible gut, people, then you're using a lot of energy in your gut. And so once your gut has tried to, you know, fight off everything that you're feeding it from your immune system standpoint, then you don't have a lot of energy left to do the other things throughout the day, right? And so that's kind of what you and I talked about. And so that's why I've become very fascinated with the gut. Yes. And I mean, the pharmaceutical companies are looking at this too, right? There's all these drug studies now about, you know, diabetes medicine and the gut and, you know, why we have all these resistance to antibiotics and different things like that. So it's just really fascinating to me. And you worked in GI health, right?
I did. And we did those fecal transplants that we talked about last time. We did that in the GI. Yeah. Yeah.
So for the listeners, Buket and I recorded this once, and we'll just say we had an audio issue. So we're recording it again for you because we thought it was amazing. So remind people, or I guess don't remind them, just tell them what we talked about as far as the fecal transplants. Yes. So you worked in GI before.
Yes, I worked in the GI pulmonary lab. So that's where we do upper endoscopies when people have epigastric pain, that pain right under the diaphragm, right there where the stomach is. For people who are like belching, burping, which we'll get to, those are all signs and symptoms of certain disorders in the gut and stomach. But some of these patients were having like severe diarrhea, and in particular, C. diff. And that can cause severe diarrhea. It smells really bad. It can like dehydrate you. You're sick, super, super sick. And in order to cure it, we offered fecal transplants. And that just means putting healthy college age students from, I believe it was MIT, that volunteer that are healthy, frozen poop that would get delivered to the hospital, and I would thaw it out as the nurse and get it ready. And then we would put it into the colonoscope, and we would go drive it up all the way to the beginning of the colon. I think we talked about the ascending colon, and let it go there. And these people were cured most of the time. And that tells you so much, because our gut bacteria has so much to do with epigenetics. It has so much to do with everything. Like, it cured them. It was amazing.
So I have lots of questions. So where did the poop come from? Do you know where the poop came from?
I believe it was MIT college students.
So they just randomly found college students and they were like, we'll pay you $20, poop in this bag. We want it. Like
more than $20. Maybe it was like $500. I don't know. But for a college kid, that's a lot of money.
Okay.
They have to have certain, I think they had to have like no chronic condition. So it was young kids. Big one here. No obesity. And I truly believe that that's because obesity starts in the gut. Mm-hmm. Yeah, it can start in the gut. And of course, you know, insulin resistance, et cetera, but all that can start in the gut. Your microbiome has a lot to do with that. And so these kids were like pretty thin, healthy, no chronic conditions, you know, not a tainted gut microbiome. And so then you give them this brand new life.
Fecal matter.
Yeah, fecal matter. And it repopulates in their gut. And then, you know, they are pretty much cured of the C. diff. And then what's really cool is one of our manager nurses was like keeping data, and some of these patients were losing weight. Go figure.
So people with C. diff were getting stool transplants from MIT college kids, which that's scary because I know what I was doing in college, but we are getting their poop and then we are getting better and we are losing weight.
Yes.
Which I mean, I honestly, you guys think in 20 years, this will be probably mainstream. Like there are going to be some people out there that have some amazing genes that are very healthy that are making a lot of money off their poop because yes, it's true. Like you can take poop from a healthy, fit, metabolically, good human, and you can give it to somebody who's not, and you can change their microbiome. And so that's why a lot of times, it is said that obesity can be related to your gut. It's the misbalance, the misalignment of the microbes in your gut. And so that's why I kind of lose my mind when I hear people say all the time, well, eat less, exercise more. That's how you lose weight. There's so many more things to weight than that. What are your hormone levels? What is your stress like? What's your cortisol? But what is your gut like? Because I totally believe that, if your gut is not good, you're not going to detoxify. And we have to detoxify, you guys. Every day you're exposed to so many toxins. You breathe them, you eat them, you put them on your skin. I don't care. I don't care how great you are. You're exposed to toxins, right? Unless you live in a bubble. Nobody lives in a bubble. Nope. You're breathing toxins, you're eating them. And so your body has to get rid of them. Okay. It does it through sweat. So this is why I get in my sauna and I sweat it out. And it does it through your hepatoenteric system, right? Your liver. And it does it through a process of glutathione and phase 1 and phase 2 detoxification, which requires glutathione, which is why I take glutathione injections weekly. And then that goes into bile and it's released into your GI tract and we poop it out. Well, if you're not pooping regularly because your GI tract is not working, right? Or all your bugs in your GI tract are stopping you from pooping, or they're stopping the process of bile leaving, or you can't produce bile. I mean, all these things, you stop detoxifying as a human. And so then all these toxins start building up, right? And then you have these bad bacteria that are eating all these things that shouldn't be, and your good bacteria are dying, and your insulin goes up because your body's like, what the heck is going on? Why are all these bad, bugs here? Why don't I have good bugs? Yeah. You can't digest your food. You can't absorb your nutrients. Your insulin goes up, your cortisol goes up, everything, your CRP, it's crazy. And then those things all cause you to not sleep well, to have brain fog, and to gain weight.
Absolutely. I mean, even estrogen detox happens in phase 2 detox in our gut. Yeah. So like if beta glucuronidase is out of control, then we recycle estrogen, we don't remove it. So yeah, our gut has so much to do with even hormones. Mm-hmm.
Yeah. When I did my first stool study in 2012 or 2022 with Dr. Rice, I needed beta glucuronidase, a lot of it. And oh my gosh, I remember taking it. Like I remember the first day I took 1.2 grams of beta glucuronidase, and I was 2 days later, I was like, holy cow, I don't feel like I'm 4 months pregnant. Like what just happened? Just little things like that.
And them together, magic.
Yeah. Yeah. And I'm super big on labs. Like my patients, I think sometimes are annoyed with all the labs that I check, but I'm really considering not seeing patients in the future in my clinic unless they will show me their poop. Unless you have zero symptoms, which is very uncommon. There's so many things I can do for you. And with this new 10 steps to ultimate health that we do at Modern Endocrine, the first step is cell membrane health. But then the second step is gut health, because until your gut's good, you can't get your hormones right. You can't detoxify. You can't, and so I need, unfortunately, or fortunately, however you want to look at it, I need to see your poop. Because I need to know what's growing in there. I need to know what should be there that's there. I need to know what's there that shouldn't be there. I need to know how your gallbladder's working and your pancreas, and how it's all working together, and how you're digesting your food, and how your calpro is your gut inflamed, all those things, right?
Yes, I love it. I tell my patients at some point, I'll meet you where you're at, because I try to think like the typical human, and we come as patients. They come to you and they're like, my thyroid, Dr. Cassie, my thyroid. So you meet them where they're at, you help them with their thyroid, but then you're going to tell them at some point, we got to see your poop. And I tell my patients that too. You're coming to me for weight loss. I'll put you on that GLP-1, teach you how to prioritize protein. I'll show you how to do compound lifting movements, etc. However, at some point, we're going to look at your hormones and we're going to look at your gut. But I'll meet you where you're at now. But if you want the whole comprehensive plan, we got to do all that at some point. And I think what I've learned, Dr. Cassie, is like giving patients bits and pieces at a time, because it's really hard to give them this whole plan and it's overwhelming and they give up. And I tell them, you don't have to do that. Like, fine, let's balance your hormones and optimize them as much as possible. Let's get you trained on that, make it something that's just like second nature for you. And then let's move on to, your gut health. And then let's move on to the next thing. And then eventually, like after a year of working with us or two, they've done the whole program and they're pros. They could probably teach it.
Yeah, no, I agree. And I do that too. I meet people where they are, but what's frustrating for me, I think even more than patients, is like, okay, I've got your hormones, managed. I've got your thyroid managed. We've got you on some detox. You're taking glutathione, you're sleeping. But then I saw 5 people today. They're still tired. Well, what's going on with your gut? Well, every one of them have a GI symptom, but none of them want to do a stool study. And it's like, I cannot make you feel better until we know what's going on with your gut. Because think about it. You eat 3 times a day, people, right? Like most people, at least you eat twice a day or once a day. This is something you're doing every single day. If it is not working correctly and that balance is out of balance, then you're not going to feel good. Right. And so, and I have people who are like, well, just give me a general GI protocol. Like, what the hell does that mean? Like, there's so many different things that could be going on with your gut, And it's like, I can give you some oral BPC, some KPV, gut tide, love it. I can give you some glutamine, some glutathione. I can, there's a few things I can give you, but it's like that's kind of like blindfolding me and spinning me around and telling me to, shoot a gun at a target. Like there's so many things that could be going on. And so it's just, I do think it's a lot. I think that inflammation, I know inflammation is the reason that people are tired, they age and they die.
Yeah.
What causes that? I think a lot of times in people, probably over 80% of the time, it is your gut health. It's what you are insulting your body with 3 times a day when you eat. You have a choice. You either insult your body or you help your body. Yeah. Most people insult their body and they don't mean to. Like they have no, it's just like we live in a world where our food is crappy, right? Like we have no food regulations. We do the best we can, but we are insulting our body most of the time when we eat, and we're not giving our body the fiber it needs and and so, yeah, that's where I get really frustrated is I don't want people to think like, oh, this thyroid medicine isn't working. These hormones aren't working. Everything I'm doing is not working. I'm walking and I'm eating, it's not working. Well, it's not working because your gut's not fixed, right? Like we got to get that balance back. We got to get the army correct, right? It's like it's almost like a World War III in your body, right? Like you got your good bacteria, you got your bad bacteria, you got the United States and we got China and we're, going back and forth. We got to make sure the United States Army has everything it needs and can outgrow the bad army. And then we got to make sure that we're getting all the supplies in there so that we have the things we need to absorb our nutrients and everything moves along and we can detoxify, right?
I think you hit the nail on the head when you talk about nutrients, because supplements are amazing and I think they're powerful and there's a time and place for it. But what's at the end of your fork is like, it can almost trump that. I can give you all the supplements, but if you're eating the processed foods, if you're giving your body the messengers and the information to create, and like you said, creating the wrong army rather than the good army. So it does take, I tell my patients, look, once we do a GI map, I need you to be ready. Like, I don't want it to be during Christmas because you're going to screw up and eat cheesecake and do all this stuff. I want it to be in a time when you're ready and you're serious about it, because I might tell you, I don't want you eating gluten anymore. I might tell you, hey, cut out the dairy. I might say, I need you to follow a specific diet for H. pylori for a little while because we got to get rid of that bad bug. Or I might tell you, you have candida and we have to really do a low sugar diet for a long time, along with supplements and maybe even medicine. So it has to be, I think gut health is hard, Dr. Cassie, because we're bombarded with junk all the time. And but I do believe that when you do eat healthy for a long time, like habits are formed in a couple weeks if you meal prep and you eat the same, or variety, but the same types of foods, fiber, macronutrients, and all these things. Your body will get used to it. It will become a habit, but you have to have a little bit of willpower to say, okay, I'm done. Like, I'm not going to eat the sugary cereals anymore. I'm going to eat fibrous food for breakfast. I'm going to eat protein for breakfast. I also believe that if patients are lifting weights, prioritizing protein, and care about like longevity as far as their muscle, they tend to follow this easier. So just start somewhere. If you're going to start lifting weights and eating protein, then you're eventually going to go down that rabbit hole of, okay, what kind of protein am I eating? Is it a good source? Where does it come from? You know?
Yeah, I think yes to all of that. And, you know, I had an episode a couple weeks ago with Dr. Sanjay, and we talked about start somewhere, just like 50%, right? Clean it out. Like do 50% better than you were, or do 10% better than you were. And then as you start to feel better, you'll keep doing better, right? 100%. I talked to a guy at the gym this morning, kind of gave me goosebumps. So he's lost 90 pounds, right? And he told me, you know, 2 years ago, I couldn't even exercise because I hurt so bad. Like my doctor kept saying exercise and eat less. And I couldn't, because if I did any exercise at all, I just hurt. And, you know, he finally said, I just tried to do 5 to 10% more every time I went. And now he's lost 90 pounds and he looks great. And he was sitting there, you know, we were sitting there doing chest presses next to each other and he's killing it. But you have to start somewhere, and you just have to do something, right? And maybe I liked how Dr. Sanjay said, don't focus maybe so much on what you shouldn't eat. Just focus on what you should be eating, which are good foods, and trying to eat a variety of foods, right? We talked about that, trying to eat 30 different foods a day, because the more variety of foods you get in your diet, the more diverse your immune system ends up being. And then because your gut is so tied to your immune system, and then the less likely you are to get sick and to develop cancer, right? And so, yes, it is just like not focusing so much on what you can't have, but focusing on the right things, what you should be doing. And if you do this after a week, you feel better, right? In general. Now, if you're doing a gut detox, you know, you've had a GI map and you're on one of these gut detoxes and you're having, you know, die-off symptoms, maybe not so much at a week, but you hang in there for another couple of weeks, you will feel better. I have about 7 or 8 people going through gut detox right now. Mm-hmm. I saw one today and it made my heart really happy because she's finally better, and she was so happy and she felt really good. She was doing her last ozone treatment and she was like, finally, for the first time in years, my stomach doesn't hurt and I'm not pooping blood. And I was like, praise God, you know, like it's so amazing. But it's rough when you're doing it the first couple weeks, but then you feel so much better, right?
Those die-off symptoms are like, for real, it's like flu symptoms. It can be for some people.
Right. Yeah. And then I have another one who's emailing me saying, you know, this is not for me. My stomach hurts. I just want an antibiotic. Why won't you give me an antibiotic? Like, let's just do antibiotics. And I'm like, that's not what you want, sister. I promise. Like, it will make everything worse. Like all the work that we've done. Yeah. It will just, you will go backwards.
Well, that used to be what we did. Like in GI, it was like triple or quadruple therapy for example, H. pylori, which is the type of bacteria that infects the stomach lining. And we would give, you know, that 2-3 different types of antibiotics at one time to kill it, because it's really hard to get rid of. But now we have so much more. We have natural remedies. We have, like we talked about before, even the Matula tea. Like this is getting rid of it. Like I just got a GI map back recently. I think I texted you about it, where it was the second round that I had to do. We did like pylorysil, H. pylori diet, changing toothbrushes and all these things. And we gave her, we just did a second round, and it was with Matula tea, and it was gone. Like, and she feels great. No more diarrhea, no more no more bloating, no more burping. She feels amazing.
Yeah. My lady that I saw today, we treated for H. pylori as well, along with some other things, you know, fat malabsorption, protein malabsorption. I mean, it was pretty bad. Diabetes, gut, you know, had high morganella because of her blood sugar issues and all the things. And it's better. But we didn't do antibiotics, you know, and they had a ton of symptoms. And so that's the other thing too, is I think a lot of people with gut issues, you know, let's talk about this too. So my gut hurts, I have acid reflux, I just take Nexium, or I take Protonix, or I take Tums, or I take, you know, and I've been on that for years. People, if you have been on an H2 blocker, So let's talk about that. What are those? What are the common ones? Nexium.
PPIs are the Nexium, Prilosec.
Yes.
Right?
Nexium.
I haven't used these.
I'm trying to think what you can get over the counter. Nexium. Omeprazole. Prilosec. Tums. Like if you are chronically taking these things, these things were made to take for a month.
Yep.
2, 3 at the most.
Right.
If you have been on these medications for years because you just have, you need a new doctor. Okay. First of all, there should not be doctors prescribing these for more than 3 months at a time. Mm-hmm. They should not. If they are, shame on them. They should be trying to figure out why the hell you have these symptoms. And if you are somebody who's been on these medicines for years, you are not doing yourself a favor. Okay. Your stomach was made acidic for a reason. When you unacidify your stomach with these medications, you don't digest food. When you don't digest food correctly, you know what happens? These big particles of food leave your stomach and they go to your small intestine, and your small intestine is not made for big particles of food, people. Our small intestine is made to absorb our nutrients. So when these big pieces of food get into your small intestine, you know what happens? The nasty army, the bad army, they eat those things up. And when they eat up those big pieces of food, then they start overgrowing the good bacteria, and then you get bloated and you get gas and you get diarrhea and or constipation. And you look, women, this is when you wake up in the morning and you feel okay, and then before you go to bed, you look 3, 4, 5 months pregnant. This is because you have something called small intestinal bacterial overgrowth, SIBO. And it's because your undigested food most likely is leaving your stomach because your stomach acid is out of whack, or you don't have, you need some gallbladder support, or you need some digestive support. Yes. And a lot of the times it's just because some doctor has put you on a medicine for acid reflux because you ate too much spicy food or whatever reason. You have H. pylori. We didn't treat it appropriately, and you're never taken off these medicines. And it is bad news long term. You can even end up with cancer. Yep. I mean, this is crazy. And so I get so flustered with this, like people that, well, I've been on that for 20 years. Well, okay. Well, that doesn't mean it's right. Like,
right. Right. Yeah. And then getting them off of it, you kind of have to like wean people off so they don't have, worse symptoms for a while. But I see a lot of people on PPIs and they do have H. pylori, and it's because they're reducing that acid, and H. pylori can like thrive in acid, but then when there's less acid, it can thrive even better. So yeah, it's no bueno for sure.
Yeah. So if anyone out there is listening to this or knows somebody who has been on a PPI, an acid blocker, something for their stomach for more than 3 months, please start asking your provider why. Like, why am I still on this? Why do I need this? Why am I still having these symptoms? Yeah. Whether they do a scope, whether they do a GI map, I don't care what they do, but you need to be asking. And if your provider tells you because you need it and you can stay on it forever, you need a new provider. Absolutely. They are a complete moron, like idiot.
Absolutely. That's true. I mean, it's just putting Band-Aids, right? Like getting your patient out of the room, like, okay, here's your refills. Just here's this and bye. But
yeah, but my problem with that, Buket, is like, that is harmful to a person, right? Yeah. Like if you're lazy and you want to get them out of the room and you're just trying to shut them up, I guess that's okay. It's really not, but you're doing something to put somebody in, like, that's harmful. That can be harmful to a person to leave them on a medication long-term like that. Right. And so that's what I met a guy last week. Well, I'd seen him back for a lab follow-up, super sweet guy. And he was like, well, but I've been on this medicine for 20 years. And I said, 20 years? And his wife's like, yeah. And I said, why? And he goes, because when I don't take it, my stomach aches. And I said, okay, well, has anyone ever looked into why it aches? And he said, well, no, they just told me to take this medicine. And I'm like, okay, well, that's a problem, right? Like, we need to figure this out. I mean, for all I know at this point, at 20 years, you could have lower esophageal cancer. I mean, we could have Barrett's esophagus. Lots of things, right? Mm-hmm. So yeah, it's just frustrating. Like the easy way is not always the right way, right?
Yeah. No, it's not. It's not. And I wasn't satisfied with it. Like, I worked in primary care for a very short period of time. I wasn't happy in it. I just felt like I needed more time with my patients. I wanted to educate about all of the lifestyle changes they can make to prevent them from having to go to primary care other than the once a year physicals. And I just didn't have enough time. I didn't have enough time to educate them. And now I do. I get a whole hour, sometimes more, with a new patient, and we explore all of these things. And it takes time to sit down and talk to your patient, look at their, like, how are they presenting? How are they explaining things? Like, even, like, I even get into mental health. I talk about that. Was there trauma? Was there, you know, things that happened in childhood? How was your gut as a child? A lot of times patients will say that they've always had a kind of a nervous gut, right? Since childhood. Well, why? Like, what happened? And, or what's going on? What wasn't, did you have a lot of antibiotics as a child? Did you wipe out a lot of your gut bacteria as a child? Like, do we need to replenish? Which ones do we need to replenish? Are there bad guys in there that we got to get rid of? So yeah, you can't do these. You can't ask these questions in primary care. You just don't have time. And I don't think that we were given the tools. We weren't educated on it either. We were just given, okay, this is the symptom. This is the Band-Aid for the symptom. And that's it. So it's not fulfilling. I'm not satisfied in, like, primary medicine.
Do you like what you've heard so far? If so, Modern Endocrine is now able to provide telehealth services in 8 states, including Arizona, Nevada, Oklahoma, Texas, Ohio, Illinois, Michigan, and Georgia. If you would like to become a patient, visit our website at www.modern-endocrine.com/contact. You can also email us at hello@modern-endocrine.com or call our office at 405-286-1571 to schedule an appointment. Please note, we no longer accept insurance for new patients. However, we do have customizable membership programs available. Your first visit will include a detailed intake, and lab orders will be provided to further assist us in developing your 10 stages to ultimate health plan. We do offer discounted lab rates with a nationwide lab service. And now back to the show. Yeah, no, you hit the, yeah, you 100% are correct. It is, here's the symptom, here's the Band-Aid, here's the next patient. And that is 100% what is wrong with healthcare in this country. We Band-Aid things, we kick people out the door. We have no thought process as to why is this happening? How do we fix it? How do we prevent it? And this is why our country is fatter, sicker, and spending more money than we ever have in 2024, despite the advances in healthcare. And nobody seems to think that it's a problem, except for people like you and I, like functional medicine type people. You know, unfortunately in school, we're not changing how we teach people. And most patients, you know, that do listen to something like this and have a little bit of like courage to say something to their doctor, then their doctor's like, no, they're idiots. And so then they just, you know, roll on. And it is really, really sad. And to your point about mental health, I see this all the time. People with mental health have terrible gut issues. 100%. So when I have a patient who comes to me and they're like, you know, I've been feeling really anxious, I've been feeling really depressed, and it's new, my first question is, well, what's going on with your gut? Yep. And a lot of times it's like, well, I had COVID a month ago. Well, I've been really constipated. Well, I have this new onset diarrhea. You guys, we absorb so many nutrients from our guts. Tryptophan. We absorb tryptophan from our gut, which is the backbone of making serotonin, which is our happy hormone. Mm-hmm. And so if you can't get tryptophan out of your gut because everything's clogged up because your bad bacteria are overgrowing for whatever reason, you ate something bad and got an infection, or you had COVID and got really inflamed, or you just jumped off the deep end and went on vacation for a week and ate a bunch of crap you shouldn't have ate, sugar, and caused all this overgrowth in your lower, GI tract, then guess what? You're not getting tryptophan out of your gut, and then you're not making serotonin, and then serotonin is definitely not crossing the blood-brain barrier and making you happy. So you feel anxious and you're depressed. Right. And it's all from your gut. Like, you don't need an SSRI. You don't need all these psych meds. You don't need all these things. You need your gut fixed. Like, that's it. Right.
100%. I saw it all the time in psych, and I remember I would wean people off of Prozac and Zoloft and other SSRIs, and we would try a supplement called 5-HTP. I do believe it helps a lot, but meanwhile, we would talk about the gut-brain connection, and it's real. Like, I remember in nursing school when I got nervous about a nursing exam or the NCLEX or finals or something, I felt nauseous, and I felt like I was going to have like go poop number 2, super water. So why? Because your brain is connected to your gut. And so I think there's like a communication, like you as an endocrinologist, there's that special communication that the hormones have. I think the gut and brain does the same thing. And yeah, I think we can heal a lot of things in our kind of settings, Dr. Cassie. I really do. And I think that I'm really excited because before, like 10 years ago, this field was not as, it was kind of seen as quackery, you know, it was kind of seen as like, oh, you know, it's not true evidence-based research, but there is enough evidence now, like with even the probiotic Akkermansia and how it functions like a GLP-1 in the gut. And if your patient comes back and their GI maps shows that they have no Akkermansia, and you look at them and you're like, this is why your gut needs Akkermansia. You need foods that produce it. You need polyphenols. You need to eat this. You need to do that. I'm going to give you some Akkermansia. And those cravings for sugar probably will go away. Or maybe you have an overgrowth of candida we have to get rid of, so those sugar cravings go away. Like, what's the root cause of your weight gain? And anyways, I probably went down a rabbit hole, but I just love that now we have providers that are offering it a lot more, and I think the word's getting out, and I think patients are getting smarter, and they're searching for people like us, and it's exciting because it makes for a good conversation when they come in the room. You're like, great, you're educated, we can like really dive deep.
It's so exciting. And to your point, the 5-HTP, I love 5-HTP, especially in somebody who has this acute onset anxiety, depression, especially if their gut's a mess. 5-HTP, some SAMe, and a methylated B complex.
Yes.
Might just change your life, people.
Yeah.
I mean, I have had, my front desk will tell you, I had my front desk, so when we started doing some SAMe stuff, my entire front desk came to me a couple of weeks ago and they're like, what is this supplement? And I'm like, why? And they're like, somebody just came in here almost crying, like that this supplement in 3 days changed their life. Like they had been so depressed and so anxious and had been put on all these different medicines. And I'm like, no, stop them. We did some 5-HTP. We did a good SAMe and my methylated mighty methyl. And they literally came back and told my front desk, like, I've never felt this good in my life. They were like almost suicidal and anxious and, you know, and told my front desk in 3 days that they felt better. Amazing. It's not rocket science. Like it's not, it makes sense from a, you know, hormone perspective and it, like how we absorb hormones. And yes, your brain gut connection, the vagus nerve is very in tune with your stomach. And, you know, to your point, Akkermansia. So I take care of diabetics, right? I see so many blood sugar issues. If you do a GI map on somebody with insulin resistance or diabetes, 9 times out of 10, unless they're already on a Esbilardi, unless they're on Esbilardi, they have low Akkermansia. And those are the people who, you know, with diabetes and insulin resistance, you've got to fix that. If you don't fix that Akkermansia, then yes, they have sugar cravings and they're going to gain weight.
Yes.
Right. And it's easy. You know how you do it, people? You feed yourself fiber. Like it's free. If you don't even want to take anything, you eat fiber. You eat the colors of the rainbow. You eat, you know, lots of different food, but you want to definitely make sure, you know, that you're eating your fiber, right?
Yes. What I think is, you know how you said like people change within days or a week? What's beautiful about it is I believe our bodies are miracles. I do believe that. And I think that if we change things, our body will respond. It doesn't take like years. It can change like now. Like you can go walk 3-4 miles and make changes in your body that are for the better. And just imagine adding extra things each time and you just get better. And so I don't think it's something that like when people look at this like, oh, I have to change everything and I have to this and I have to that. But like you mentioned, change 1 or 2 things and your body's going to respond and you're going to like how it responds and you're going to want to give it those good things. You're going to, some people just get to the point where like, I'm sick and tired of being sick and tired and I'm going to do what you say and they feel better and they don't want to go back. So, yeah. I love that though. You see diabetics and you can see their GI maps, and I'm sure
their acromantia is almost always low. They also a lot of times have gallbladder issues, right? So their steatocrit is, not like they're having problems processing fat.
Yep.
They're, a lot of times their pancreatic enzymes are bad.
Yes.
Especially if they're requiring insulin.
Yes.
And so just giving them digestive enzymes and giving them, something to support the acromantia, or even just having them eat fiber or maybe a little sodium butyrate, can do some amazing things to your gut. The other thing is, to your point, like, you can make tiny changes, you guys, and change the microbiome in your gut. So for instance, cutting out half of the carbs and processed foods you're eating, just half of them. You start starving those bad staph and strep, right? So staph and strep that are overgrown in your small intestine, if they don't have carbs, they start dying. They're mad, right? Yeah. So you take away some of those processed carbs and fat, immediately that starts to go away, right? And then it's just, give yourself a little bit of fiber. Then you start making more of your good, bacteria that need fiber. You increase your acromantia. Yes. And so it's easy. Like you and I, we talk about this. You can look at it. The GI maps that we use are very, very detailed, in depth. Yes, and so you can go through every single commensal bacteria and every single bacterial phyla and every single, protozoa and candida. And you can nitpick every single piece of it, but you can also do little things like, okay, let's stop eating all of the, processed carbs and sugar. Yeah. And then let's set down to eat, people. Oh my God, you don't know the amount of GI studies I look at where you can tell stress is a huge part. And it's because we stand up when we eat. We don't chew our food properly. We're on the go, moving around. We don't you can do a lot of things just by setting down, chewing your food, taking 10 minutes to eat, and not being stressed, right? And then cutting the carbs out. That right there will fix what? 50% of GI maps?
Definitely. Definitely. Yeah. Yeah. Cause digestion starts in your salivary glands, right? Your salivary juices breaking down there. And if you're chewing extra, you're helping that further breaking down, and it gets into in your intestines. Yeah. And your stomach.
Well, I guess we should say, assuming you're not on a PPI, cause you got to take that away too.
Ooh, that's true. Yeah. Yeah. Cause if you're on a PPI, you're not going to absorb as well, cause you don't have enough acid to break it down. Yeah.
Yeah. And I tell people this too when I do my lecture every month in Dallas. I say, and I kind of stole this from my friend Marcos, but your body, you guys, cannot call you. It can't text you. It can't send you an email. If you are doing something to your body that it doesn't like, it tells you in the form of symptoms.
Yeah.
You're bloated. You have acid reflux. You're pooping your brains out, or you're not pooping at all. Mm-hmm. You look 3 months pregnant, 4 months pregnant before you go to bed. You have gas. Your stomach hurts.
Acne.
You have acne. Rashes. Oh my gosh, your acne is terrible. Like, if your stomach is upset, it's going to tell you you're tired. Like, no matter what, you're tired, right? Because guess what? 70 to 80% of your immune system is in your gut. And if your gut is, your stomach is a mess and you have leaky gut and things are falling out of your gut because the cells aren't all stuck together, and every time you eat, you've got all this crap leaking out of your gut into your bloodstream that are all these, pieces and particles of food, then your immune system goes, oh my gosh, what are these particles of food? Then your immune system sends this whole army to the lining of your stomach, which, by the way, y'all, your small intestine is like how many football fields? Like 12 football fields long or something. It's insane how much surface area is in your small intestine. So now your body's sending your entire immune system to your whole small intestine because it's leaky, trying to grab all these food particles that are leaving your stomach, because our food was never supposed to leave our stomach in small particles or any part of our GI tract, right? It's supposed to be absorbed. The nutrients are supposed to be absorbed, and then everything comes out as waste. Yes. Well, people are walking around with all this food floating around in their body, and immune complexes are being made. Interleukin-6, tissue necrosis factor 1, or tissue necrosis factor alpha are all coming to the rescue, to rescue whatever's, come into your body from your GI tract. Well, it's the crappy food we're eating. And then you get all this inflammation, and then your body goes, oh, this is just the Cheeto you ate yesterday. Okay, well, fine. But now we've already wasted all this energy to bring all the forces to stop the Cheeto from invading your body. So now we can halt and go back to doing what we were doing. Oh, wait, here comes another Cheeto particle. Oh, wait, here comes, cereal. Here comes all these things that are leaking through all these holes in your gut. By the time your food is passed and it's done, you're eating again. So it's like your body is just like, dang, I can't do the work I'm supposed to do, right?
Right.
And so that's why you're tired.
Until you get to sleep when you're not eating, but then are you sleeping enough to repair?
Right. Well, or can you, yes, are you? Or can you even sleep? Like, is your blood sugar still high because of the crap that you ate? So is your body working on that? It's just,
it's the wine you drank before bed because you can't sleep. Yeah, it's definitely
right. Or all the medicine that you're on because your doctor said that you were crazy. So they gave you an SSRI because really you're not going through menopause, and that's just all crazy. You don't need your hormones, and you're anxious just because it's normal to be anxious when you're 50. And so it's also normal to just not sleep, right? I'm kidding.
You're being put on propanolol because you're having palpitations due to going through menopause, and it's not cardiac. Oh, I've seen that so much too. I'm like, give the woman estrogen, please.
Right.
Oh, yeah.
Right.
But no, I think it's definitely, I think the GI map really helps people see data because, like you said, we can kind of blindfold and say, okay, eat fiber, eat this, do that. But when you show your patient like the Christmas tree that comes back and you're like, okay, this is what you're lacking. This is what you need to supplement with. This is a lifestyle change you need to make. And then they also get answers like, I had a young girl the other day come in, super sweet. She said she thinks she needed like a vitamin test. And that's something I want to bring on. I think we were talking about that, like a micronutrient test, right? And I'm like, okay, she sounds like that's what she wants. We did an intake and everything. I'm like, I'm excited. Maybe she can be my first patient. We can kind of learn this together. So she sat down and we're talking and I'm like, sweetie, I mean, I can do a vitamin test on you, but everything you're telling me, I think you need a GI map. Like you're having epigastric pain, you're burping, you're having constipation and diarrhea, your skin's acting weird. You say you have pressure here and pain. I was like, I really think you have H. pylori and I think it's gut stuff. And I can give you all the vitamins and minerals, but we need to fix your gut so then I can do a vitamin nutrition test and then you can absorb them properly. And she's like, yeah. And I'm like, yeah. So we just did a GI map and we're waiting on the results and I'm really excited to see, but it's, I'm excited. I'll share the results with you and see how that goes. But she really wanted to do like vitamin tests and I'm like, sure, but I want you to really do this. This is what I think is wrong with you. It's your gut. And so we'll see what happens.
Yeah. And I agree because even if she is micronutrient deficient, which sometimes that's how I talk people into doing GI tests, right? Like I can do some blood tests for some, like I'll check an iodine, I'll check a ferritin, B12, folate, D. If you've got somebody who, I mean, if you've got somebody who is deficient in all of those things and they've got like a low calcium and their albumin's low, I'm like, what is going on with your gut? Like there's something not right because even if you replace those things, they're probably not going to be absorbed by your gut. Yes. So that's why, whenever I was creating the 10 steps to ultimate health, I kind of went back and forth, like cell membrane, number one, no questions asked. Because if you don't have a healthy cell membrane, the rest of you is screwed. Like, I mean, you've got to have a cell membrane so that you can create ATP, electron transport chain, so that your cell can work. I mean, the mitochondrial membrane and the cell membrane they have to work, people. But then I was like, okay, is gut health more important or is micronutrients more important? But in my mind, like you have to have a gut that works or your micronutrients don't matter. And I've seen it. I saw a lady not too long ago who has all these low micronutrients. And it's like, dude, like I told her, I was like, I can give you 10 vitamins to take, but something's going on with your gut. And I think it's that honestly, I'm waiting, but I think she's got a stomach acid issue and a digestion issue because something's not right. And so then you fix that, the question is why you fix it. And then, you probably don't need 10 vitamins forever. You just need to fix why is your stomach acid not working? Why is your stomach not breaking down the food like it's supposed to? Right. And then why are you not able to digest it?
Right. And supplements they come in clutch. They're great. And sometimes we need them. Like vitamin D, I'm probably going to take for the rest of my life with K2. That's just something I'm going to take because I like my levels to be at 80. But like, some supplements I think that we can kind of let go of if the gut's functioning properly and you're absorbing properly. So, it's worth it to me. Definitely worth it.
I agree. So I kind of rotate my supplements. I have my core that I always take, right? I'm always going to take a membrane health supplement, always. I don't care. I want my membranes to be functioning. I always am going to take a probiotic. I cycle those depending on what's going on. I'm always going to take a vitamin D. Yeah. I have an MTHFR gene, so I'm always going to be on a methylated B complex. I like SAMe. It makes me feel better, especially when I'm stressed. So I'm always going to be on that because of my MTHFR. But then my other stuff, I cycle. It kind of depends, right? Depends on what's going on. Depends on what's going on with my gut. I have a stool study downstairs I haven't done yet, but I'm going to. Like I'm going to do one at least once a year. Yes. So it just depends on what's going on and I feel good. I actually, I was talking to my husband last night, I sometimes am tired, but in general, I feel pretty good. And if I actually sat back and think about all the things that I do and like my life over the last 6 months, I should be like deadbeat tired in a coffin somewhere, like not getting up. Like there's just been so many things going on and I wake up, go to the gym. I feel pretty good. So, yeah,
I see.
But I still want to know what's going on with my gut.
Like, she's working. She's like a boss babe. She's an amazing doctor. She's at the gym. I'm like, I need to get myself up. It's time for me to go to the gym.
But I still want to know what's going on with my gut, right? Because you never know. Like you never know. I need to cycle my probiotic. I need to, I don't know.
And like secretory IgA too. The GI map shows that. And that tells us exactly what our immune system is doing. And I've seen it really high and I've seen it really low. And then when it's low, we'll give colostrum for a couple months and you can fix that. So that's really cool. And then of course the beta glucuronidase for it's really good. Like it's not just gut, it's how it innervates all the other stuff too, like especially with hormones. So that's why I tell my ladies, if I'm giving you hormones, at some point you're going to get a GI map because I got to see where you phase 2 detoxing properly, Yeah,
no, for sure. I love that. And yeah, it's true. Like you want to know what's going on. You want to know all the things. And to be honest with you, when I'm super stressed, like the last couple of months, I knew I'd be stressed. I throw in some SBI Protect. Like I've been taking it for, I'll throw it in my shake because I know I'm stressed. So I might as well get that extra, boost for my immune system. So I do little things like that just because I know how much stress affects you. Yeah. I also though try to I think you can mentally talk to yourself, right? So instead of using the word stress, like beginning of May, I was super stressed. I had a lot of stuff going on with my old clinic and the old group I was with and just anyways. So I was super stressed. But then, 2 weeks in, I sat myself down and I had a little talk with myself and it went like this. Cassie, you got to get it together. You can't let somebody ruin all the great momentum you have going on. You're not stressed. You're excited. Like done, finished. I love that. You're not stressed. You're excited. Like who cares? Move on. And so, sometimes they're just, and I've been in it, it's been better, but there are little things that you can do when you feel stressed, right? For your immune system, you can sleep a little bit more. I am a 6-day-a-week gym person. Like I just feel good in the gym, but I will tell you the last couple of weeks, I've been a 4 to 5 day a week gym person. And I've just given myself a little bit of grace. And if I'm tired, I stay in bed or I'll go for a walk and guess what, ladies? My weight has not changed. My muscle mass has not changed. Yeah. My stomach still looks the same. You can give yourself a little bit of grace. Your body is resilient.
Yes, it is. And you can build muscle back. I do think it does have memory because when I lifted weights a while back and stopped because of being super excited, I'm going to start using that term.
Yeah, excited. Not stressed, excited. We are excited.
Getting back and I go with my husband on the weekends and he pushes me to failure and I love it because I'm deadlifting 150 pounds. I'm like, yes, he pushes me and it feels good. I think I go about 3, maybe 4, but mostly 3. Saturday, Sunday for sure with him. And then one day during the week, I'll go by myself, but I love lifting weights. It's I feel strong. I feel just great. And I get on the InBody and if I'm building muscle, that's all I'm worried about because I know the fat will come off as I'm building muscle. But yeah, being excited is not good for you. I like
being excited. Being excited. It's all about a mind. It's really all about a mindset change. It really is. When somebody told me that, and I, especially this week. So we're moving our clinic tomorrow. Okay, I did clinic today.
It looks so pretty.
I did clinic today. I saw people today just like nothing was happening tomorrow, and people were in my clinic packing stuff up and moving stuff around. And I'm looking for lidocaine because I need to do a pellet, and I was just. doing a lot of deep breathing, and thank God for Sarah, one of my MAs who just keeps it on she's just like a chronic meditator. But all day long, I was like, I'm excited. I'm excited. I'm excited. And it changes your mindset. It really does. I am not stressed. I'm excited. Like I am. I'm super excited. I'm stressed too, probably, but I'm excited. If you say it like that, then it's better. Right. Yes. And you really just, the other thing too, that you always have to keep in mind, a little bit of perspective. You can sit there and stress about everything. I used to do this. I used to sit there and think, oh my gosh, what if this, what if this, what if this, what if this? You guys, 90% of the stuff that you're stressed about will never happen. 90%. Never happens. So you're just wasting a bunch of energy, a bunch of time, jacking up your gut, jacking up your sleep. Just, and it takes a little bit of time, I think. I'm almost 40 now. And so whenever I was in my 20s, that definitely wasn't happening in my lower 30s. But that's the way I try to look at things now, is like, I'm excited. Yeah. And then remembering that 90% of what you actually sat there and stress about, never even going to happen.
That's true. It doesn't. But our brain doesn't know perceived versus true threat. If we're imagining it, it thinks that that's what's happening, and it makes that response, and cortisol goes up. You know what happens.
But the healthier your gut is, the better that is, because then, you're getting your tryptophan, you're getting your serotonin, especially if you're taking your SAMe. So but the other thing is, I've also learned as I get a little bit older too, I don't know, I just have a little bit of faith, right? I have a lot of faith. God has tested me this year, way more faith than I've ever had in my life. But just got to have some faith. I think that if you wake up every day with a good intention, you do the right thing, and you're a good human, that's all you can do. And usually doesn't fail you, right?
I agree. That's true.
So, amen. Yeah, that's what my year's been about anyways. A lot of faith. So,
well, I think you'll be able to look back and sometimes you look back and you go, how the hell did I do that? Well, I did it. You did it.
I know. I'm probably going to do that next year. Like, how the hell did I do that? But
that's what you're going to do.
The answer is being excited, taking good care of yourself, giving yourself some grace too. I will say, giving yourself grace is helpful as well, because 3 years ago, if yesterday morning, I woke up and I was like, man, I'm tired. I just went back to sleep. 3 years ago, I would have been like, nope, get up. You're going to the gym. Sometimes you just got to give yourself a little bit of grace, you know?
Yes.
And guess what? My muscles looked just the same today when I was pumping iron. Yeah. Then they looked Tuesday, even though I gave myself some grace on Wednesday. So it's like,
were better. Your body was probably like, we built so much more during rest. Thanks for that. Well,
right.
Yeah.
Right.
And for me, Dr. Cassie, I think the game changer for me was when I figured out my PMS symptoms and my slight PMDD symptoms, and cured myself. I really do believe with progesterone. It changed my life, and I dealt with that for so long, and I'm like, why is this going on? Why is this going on? I just believe I've always had a really a progesterone deficiency in my 20s. After I was done having my kids, I had them really young, and that's what caused it, I do believe. And I love my progesterone. I love my progesterone
too.
I love it.
Yeah.
And my LDN, I take low dose naltrexone. Speaking of SIBO, it's indicated for that too. So I like taking LDN. I think that's I consider it a supplement that I'll never stop. I absolutely love my LDN, especially in the research where it talks about suppressing tumor growth, or suppressing tumor cells or tumor growth cells, etc. I'm like, nope, that's my preventative prophylactic medication there.
Yeah, and I think
disorders and Hashimoto's, to lower TPO antibodies and inflammation. I love it.
Yeah, I think that's where I was going with LDN. So LDN I use with Hashi's a lot. Mm-hmm. And what I see with LDN is that it lowers your TPO antibody. Mm-hmm. And I don't know that anyone knows why, but I can tell you that it lowers your inflammatory markers. It lowers your CRP, it lowers your ESR, it lowers your TPO. Yes. And in doing that, that means inflammation's going down. And when inflammation's going down, you're going to have a decreased risk of cancer, mortality, everything. And so I completely agree with that. I see that a lot with LDN, and I don't know why, but I do. And so I take LDN too. We're on the same bedtime regimen. LDN, progesterone, brush my teeth, do my face routine, sit in front of my red light. I'm thankful, and I go to bed.
Yep. And you sleep like a baby. Yes.
Sleep like a baby.
I want to get an Aura ring though. I don't know if you told your patients, but my colleagues posted about how HSA and FSA or something like that covers it. So I'm going to get it anyways, but I posted that on my Instagram for my patients to see, because I do believe it's a good, oh, look at you. You have one.
I do, but I have a love-hate relationship with my Aura ring. So after my interview, I think it was episode 13 with Justine, you know, talking about bad light and bad like electron therapy and just cell membrane health. So this is Bluetooth.
Okay.
Oh, you shouldn't have Bluetooth constantly on you, most likely. I mean, that's a big issue with our phone. Yeah. So I have a love-hate relationship with my Oura Ring, because I will tell you it does help me. Like yesterday morning when I woke up and I was tired, it told me on Tuesday, like, hey, you know, you should probably take a break. You're resting. Heart rate is elevated, you know. So I actually listen to it. So it's kind of a love. It's kind of like your abs at the gym, right? Like you love hate to do them. Like you want to see them, but it hurts to do them. It's the same thing with the data on your Oura Ring, people. Like you want to see it, but it may be hurting you with that Bluetooth. So I don't know, but I do have one. Yes.
I think I want to try it. I mean, I know the Bluetooth is, I think when our mutual friend Amanda was talking about how she was changing her headphones to different kinds. I believe that. I mean, for a while I was really, really into that. I try not to do like the phone on my head. I'll do texting, or I'll talk text, or I'll speakerphone if I can. Like I don't like to put it right on my head. But again, back in the day, this was quackery stuff, Dr. Cassie. When I talked about this stuff, people looked at me and they were like, you're crazy. And I'm like, yeah, just give it 10 years. Yeah. And here we are. Here we are.
I know. We'll probably be crazy still, though, for another 10 years, but that's okay. Probably. You know what? I'm okay with it. I'm fine with being crazy, because I'm okay with it because, you know, now in my career, it's been what, 7, 8 years. I don't know how many people I've seen and treated, thousands. Mm-hmm. I'm going to tell you that in the last 4 years, when I've been on this quackery kick, so many people have gotten better. So many people, you know, cry and hug me and tell me that I've changed their life and that I listen to them. So I'll be on the quackery train as long as you want me to, because you know what? You know what, you guys, there are thousands of doctors in Oklahoma City that will write you a pill and give you whatever you want and put you on stimulants and, you know, give you SSRIs and kick you out the door. Go see one of them. Have at it. There's not very many of us that will actually try to figure out what's wrong with you and make you better. And I am dedicated to doing that. Like I will, you know, you'll give up before I will. Like we'll figure it out if you'll just get on board.
Yeah, I agree. And it just takes some time. Like we don't know everything either, right? I'm the first to say I don't know it all. And sometimes I'll say, hey, there's this new thing I'm bringing on to my patients. And I'll say, do you want to do it with me? You want to give it a try? And they're like, yeah.
You want to learn with me?
Yeah, let's learn together. And the GI map was one of those. It was like, I really want to, like, I know a lot about gut health from like on my own, kind of like what I've learned, but like, I really want to get into like why and what can we optimize, and it's what's concrete. And when I brought on GI map, my first few patients were, hey, do you want to try it? Like, they're like, yeah, like I want to do it. And we did. And here we are, you know, like, and I want to do ozone therapy. And when I learned that with you, probably, I'll be doing the same thing. Tell my patients, you want to try this?
Yeah. No, so that's the same thing with me. When we started the GI map, you know, you talked me into it and I was like, okay, let's do it. And I ordered them on my patients, and I just told my patients, like, here's what I'm going to do. I'm going to order this. I'm going to call, like I talked to you, and then you talked to me about, you know, getting a hold of those people in Canada. And so every GI map I do on a patient, I make a plan, but then I call a doctor that is way smarter than me in Canada. I get on the phone. I was on the phone with one last night at 6 o'clock going over GI maps. My husband's like, what the hell are you doing at 6 o'clock? I'm on the phone for 2 hours going over GI maps. And I'm like, I'm going to make sure that my patients have the best care possible. Like they did this study. I'm in it with them. Like I'm still learning, you know, but I'm in it to win it. Like I am in it to learn it and win it for my patients. So, and I have zero ego. I'll just tell them like, dang, this looks bad. This is what I would do. But I'm going to call somebody who's way smarter than me in Canada, and they're going to tell me whether I'm right or not, you know? And, you know, and one day I probably won't have to call those people, but I want to go over 1,000 of these with somebody smarter than I am until I don't. Right? Because that's just how I am. Like if I'm going to learn it, I'm going to learn it. And, you know, the same thing with like my ozone and cellular tissue therapy and all that. Like I'm texting Dr. Pete today. I did a podcast with Dr. Pete about sexual health a couple of weeks ago. I was texting him today about some ozone stuff. He does a lot of ozone. I have a patient that we're treating that's been a little challenging, but you know what? They're getting better. And so that makes me happy. Right. And if Dr. Pete doesn't know the answer, then I'm going to text the person who knows the most about ozone in the country, because I have their number too. Like, I'm going to figure it out. And I'm not scared to figure it out. I'm not scared to tell you I don't know the answer. I'll figure it out.
Absolutely. And I think that's why your patients probably adore you and love you. Like, you're human. We're human. Like, we don't know everything. But we're resourceful. We're resourceful, and we know how to contact people and ask them. Like, after you taught me about PCOS patients and just giving them 200 milligrams, I told my patients, I had 2 with PCOS, that I said, all right, we're only on 100 milligrams. I talked to like a freaking amazing endocrinologist last night, and I messaged him through the portal, and I'm like, I'm changing your plan because she knows more than I do about this. I 100% trust her, and I'm not scared. I'm giving you 200 milligrams of progesterone. They're like, okay, who's that doctor? I'm like, follow her. It's Modern Endocrine. She's a mentor of mine, and we're doing this.
Well, just like the guy you were talking to me about before we got on here too. Like, you're up. Like, you're going to make him better. 200 a week. You're going to make him better. Yes. Like,
I have testosterone. I was asking her about advice on a patient that I have. We're trying to get his testosterone levels, and she just like gave me the confidence to increase the dose. So thank you.
Yeah. No, and that's what, I mean, that's what it should all be about. Like, that's why, I mean, tons of providers message me on Facebook, Instagram, and I try to respond to all of them. Sometimes it takes me a little while, and I'm sorry, you guys, but I try to respond to you because, I mean, ask people, be resourceful. I ask people questions all the time. If you guys knew how many doctors' phone numbers was in my phone, like, I text people all the time that are smarter than me every day almost. Like, I have the OBGYNs I look up to, and the nephrologist and the cardiologist. Like, I'm not scared to ask anybody a question. If they get annoyed and don't answer it, fine. If they think I'm an idiot, fine. The only stupid question is the one that you don't ask, especially when you're doing it for the right reason, right? I'm not doing it for my ego. I'm doing it because I want to help somebody get better. So like, I'm going to ask, and I'm going to keep asking, and I'm going to keep asking until I find the right person to make the person feel better, and hopefully one day I won't have to keep asking, but you're always going to be learning something, right? I mean, one day I am hoping that I don't have to call this poor doctor in Canada and go over stool studies at 6:00 at night. But she's very nice. She's so nice. Like, she goes over all of them with me. Very kind, like, super sweet lady. And I love that, like, that's,
and it's interesting because some of when I did that and called them, sometimes I would get a different doctor, and it's beautiful because everybody has a slightly different way of doing it. And then I think after you do enough of them, you start having your own kind of, okay, this protocol for this and this protocol for that. Yep. And that's the beauty, is that then when we all come together and we talk and you go, hey, how do you clear H. pylori? Or how do you get rid of candida? And then I'm like, well, this is what I do. Okay, well, this is what I do. And then, it's nice.
Well, and the other cool thing, I felt good about myself last night. I'm just going to say, we were talking about digestion in general. And I had this patient who was having issues with like protein and fat and carbs, like the whole shebang. And so I was like, well, I'm probably going to give her Digestime V from Orthomolecular. And she's like, well, I'm not familiar with that product. And so she like looks it up, her and I are nerding out on, we're looking, and she's like, oh my gosh, that's a great product. How did you find that? I'm like, well, the last time I talked to you, talked about this, and I was Googling this, and like, so I taught her something last night. So I was like, like, but the great thing about like now in Google is like, you can teach yourself so much, Yes. So when patients come to me and they're like, I Googled this and this is what I said. And I'm not going to lie to you. In 2017, I used to like cringe when people say that. Now when people are like, I Googled this and I found this, I'm like, great, let's look at it. Like, teach me something,
Yes.
It's amazing.
I mean, and the power of anecdotal evidence too, I think it's powerful. Like, I mean, we can't do double-blind, placebo, test-controlled room, this, that. Like, we can't do that with everything. But if you see enough patients, you've seen thousands of patients, you can start gathering your own data, and there's anecdotal evidence to back up your protocols,
Oh, yeah.
And we're not doing things that could kill people. It's gut health, guys. Like, it's stuff that's like, it's not going to kill you. Like,
what is going to kill you is eating the standard American diet, being inflamed, being obese. All that shit is going to kill you. Like obesity, and that's what drives me crazy too. Like the other thing, I'm going to get on a pedestal for 1 second. People that throw a fit about microdosing GLP-1s and how it's going to cause you to be constipated and all these terrible things. I'm going to go on record right now on August 8th, 2024, and I'm going to say that in 10 years,
Yeah.
The amount of cancer in this country is going to be down astronomically because of the massive amount of people that take GLP-1s, because it lowers inflammation. Absolutely. Just because it lowers inflammation. I don't give a shit what else it does. Yes, you lose weight, which is great. And I love that people are losing weight, because your number one risk factor for cancer in this country is you're obese. Okay. But what it does in microdoses is it lowers inflammation. And when you lower inflammation and you lose weight, magical things happen. So I'm going to tell you right now that by 2034, cancer rates in this country are going to be a lot lower, only because so many millions of people take GLP-1s.
I love it. I microdose. I'm on it now. I don't think I'll ever come off.
I mean, it's just the inflammation is just,
And I've played around with it too. I've played around with it myself with microdosing semaglutide right now. It's with tirzepatide, and it's low doses. And sometimes I'll go like 14 days every 2 weeks or whatever. I feel it. And my patients will tell me sometimes too when they start. I have a menopausal patient right now. We did a follow-up today. She's so happy. She needed estrogen so bad. So we did estrogen, progesterone, and I put her on semaglutide, 0.25 milligrams, probably where we'll stay. And she's already lost 6 pounds, and it was inflammation. She's like, I know it's inflammation, Buket, because we talked about it. And I'm like, yeah, that's what it is, because she's prioritizing protein. I will not prescribe GLP-1s, whether it's microdosing or general dosing or what have you, unless my patients are educated on protein. And nobody's eating less than like 130 grams in my practice. So I keep track of that. I hold them accountable. We're not losing muscle because we check InBody. And if we do, which is inevitable with weight loss sometimes, it's not a big huge amount of it. It's very light, like low, and we maintain it with supplements like Loose Energy and things that you also use in your practice. But long story short, yes, her inflammation is down. She's feeling great, and I agree with you.
Yeah, no, and I agree too. That's how we do it at our practice now. We InBody. We look at your muscle mass. You're losing fat mass. If you're losing muscle mass in my practice, you're coming off or you're going down on the dose. I'm not trying to have people walking around with the Ozempic face. I don't want my patients having an O face. Like you can go to another doctor and they can take your money. I don't want your money. I want you to be healthy. I don't need you, yes. So you're losing fat mass. You're not losing muscle mass.
Right.
I'm serious about that. We do InBodies, because if you are losing fat mass and not muscle mass, you're not going to gain the weight back, and you're going to be so much healthier. Absolutely. If you're losing muscle mass, you're not going to be healthy. And so it's just, so the microdosing of GLP-1s is great too. And there's a lot of, back and forth about, well, this can be bad for your gut. It can cause constipation. Again, in my clinical practice, what I have seen, and I follow a lot of labs, people, like I am a lab, like my patients will tell you, your insulin goes down, your CRP goes down, your triglycerides come down, your waist circumference goes down, all your your TPO markers go down, all your inflammatory markers go down, even on microdoses. And if you use a microdose and you're drinking enough water and they are exercising, so they have motility to their gut, it doesn't slow their GI tract down. If it does, and you are having really bad constipation, you need a lower dose, or you need more water, or you need more fiber. I mean, something is not right there, right?
Right.
And so that's just me off my microdosing GLP-1 box. By the way, I am going to be on a national summit, you guys. I was asked to be a speaker on a national weight loss summit in October. It'll be airing in October. I'll put it on my social. I am going to be talking about microdosing GLP-1s on a national web summit with a lady who's doing something about weight loss. And she was like, well, doctors never talk about microdosing. What are you talking about? I'm okay, sister, we're going to talk about it. So I'm super excited because people need to know. But we digress. Back to gut health. So let's wrap it up with, what lab test would you recommend? Like if somebody is having a lot of issues with their gut, are there certain lab tests that you would recommend? What do you do in your practice if somebody comes in and you just feel like their gut is a train wreck based on their symptoms? So they're having gas and bloating, diarrhea, constipation, abdominal pain. What lab test would you recommend besides a GI map? Because obviously the GI map, I do mine with zonulin. I don't know whether you do. I like the zonulin. What else do you recommend?
Gosh, that's a good question. Like I would look at their HSCRP, maybe their lipid profile, amylase, lipase, possibly see what's going on with their pancreatic function. typical CBC, if there's any kind of elevated white blood cells. Probably that's it. Like I tend to go towards the GI map mostly, but those may be some of the labs I look at. What do you do outside of GI map?
So I think those are all good. I'm going to look at somebody's thyroid always, because thyroid can present in so many ways, right? And I like to look at thyroid too, because I think your thyroid is a representation of your overall health. So if your thyroid's sick, I know you've got some things going on. So I like to look at a TPO antibody in their thyroid. I'm going to look at their insulin, because I want to know if their insulin's high, then we've probably got a fiber issue, right? We've probably got an acromantia issue. I want to look at their cortisol, because I want to know how stressed they are and how their adrenals doing. Because if their adrenals are bad, then their gut's probably going to be bad. But then, yes, really, those are some things, some key things I want to look at. I think amylase and lipase is a good idea. If you're doing a GI map, though, you're going to see how well their pancreas is working, right?
Yeah.
But yes, if you guys are having really bad GI symptoms, I think a CBC is a good point, because you want to make sure they're not anemic. But then I'm also going to look at their vitamins, like I told you, like a B, a D, a ferritin, an iodine, a folate. Because if those are if they're nutritionally deficient across the board, I know something is going on with their gut. Yeah. So just more evidence to kind of show them. I'm a huge lab person, just because I see some crazy stuff, you guys. Like, I'll see somebody who walks in and they look like, Miss America's spitting image, like the pillar of health. And you get their labs and I'm like, oh my God, like you are a ticking time bomb. Or you'll see somebody who looks maybe not the spitting image of health, and you check their labs and you're like, dang, you're actually doing pretty good. You know what I mean? Like, I want to put you on an in-body scan, because you might have a lot more muscle than it appears that you have, because you're metabolically healthy,
Yeah. Even, and as far as GI maps too, like sometimes people don't come with like gut symptoms, but you check their maps and they're like, whoa, what's going on here? You have no gut symptoms, but you got a lot of stuff going on in your gut.
Right. Yeah. Or they have symptoms that aren't related to their gut at all. Anxiety, depression. I saw a guy recently who was like, I don't know, I just turned 50 and I'm so anxious. And I used to be, killing it at work, very successful, influential person in Oklahoma City. And all of a sudden just started having really bad anxiety, depression. I looked at their gut and I'm like, ding, 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 ding. I can tell you why. And then we started thinking about it. Oh, by the way, I got really sick 2 months ago, and it might've been COVID. I don't know, but I'm pretty healthy. So I got over it pretty quickly. And then all of a sudden these symptoms started to develop. Well, let's just fix your gut. Right.
Yeah.
So I would say if you guys are having these symptoms, you really need to talk to your provider about doing some basic lab work that we talked about, and then getting a GI map. And if your provider can't do a GI map, and I mean a real GI map, not this BS that DLO does that's like not very informative, right? Like, and I don't mean like a hydrogen breath test either, because like 30% of those are not right. I mean like a real GI map. Okay. Yeah, so I use Rupa Health.
Send it off.
I use Rupa Health, and you get a 5-page analysis, right? With all of these opportunistic infections and commensal bacteria and how things are working. Like, I mean a real GI map. If your provider doesn't know how to do that, find a functional medicine provider. Okay. If they don't know how to do that. If you're in one of the 8 states that Modern Endocrine can see you in, get on our website and make an appointment. Like, let's make an appointment. I can drop ship it to you. Let's look at your poop. Like, let me look at your poop, get you a plan, and you can go back to your doctor if you want. Like, but for God's sakes, let somebody look at your poop. Okay. That's my advice. Right.
I agree. I think it's the foundation of your health for sure. For sure.
Step 2.
And what's beautiful about it too is you can retest. Like, you can fix things and then retest and look at all the good that's happened, and your patients can see it like, wow, we got rid of this, and we've replenished this, and it's working. What you gave me is actually working.
Yeah. So. And they'll know by how they feel too. That's what I tell people. When you're eating right, you feel good, right?
Yep.
Like I'm very in tune with my body now that I feel better. I don't know. But like, if I go somewhere, like if I go out of town for the weekend in 2 days, I don't eat I don't ever eat terrible anymore. I'm not saying I don't eat bad, but like, I don't eat like I used to eat. You're not finding me at a fast food drive-thru. I'm not eating. But if I go out of town and I don't eat what I normally eat for 2 days, I can tell. Like, I don't feel bad. Like, I don't sleep as well. I don't function as well. So if you don't feel good and you're tired and doctors have said everything's fine, then I would highly recommend, especially if you have any of the symptoms we talked about, to at least consider doing a gut test at least once.
Yeah.
Right?
Like the biggest symptoms I think I wrote down, abdominal pain or discomfort, bloating, burping, nausea, vomiting, loss of appetite, unintended weight loss. Those are all things to consider for like bad bacterial infections that could be going on.
But also weight gain. Like if you're somebody, this is what kills me too. This happened to me, you guys, in 2022. I would wake up in the morning and I would be like a size 0 and I'd be feeling good. And by the time I went to bed at night, I swear I looked like I was 5 months pregnant. I couldn't put my pants on. My stomach had blown up like 2 inches. It was uncomfortable. It felt like you had to poop, like it hurt, Yes. And I was like, what in the hell is going on? Yeah. My gut was a mess, right? And the only time it didn't hurt is if I didn't eat. I was like, okay, fine, I just won't eat. But that's not good either on your body, right? And so my gut was a train wreck, like, and then you fix it. I, got on some SBI Protect. I got on calcium D-glucuronate. I got on better food, was exercising, was sleeping. It went away, I mean, it took like a month and it went away.
Yeah. Man, it's amazing how fast, like you went all this time with those symptoms and how fast you were able to fix it.
Yeah.
I think if the body, like I said, I feel like it's a miracle. We just have to give it the right tools to heal and repair.
100%. I truly believe your body can repair itself from anything, assuming that you give it what it needs. Now, I also believe in the body keeps the score. If any of you guys have ever read that book, you should. But the damage that you do to your body over time from trauma, from stress, from food, from alcohol, from lack of sleep, from bad light, the way you talk to yourself, the way you say things to yourself, those things add up.
That's true. I remember I used to be super pessimistic and negative and super anxious years ago. And I don't know what happened. I let go of that. And now I'm like, I typically tend to be more positive. You just kind of have to, like, you can't be negative all the time. It really just walk around like,
well, you can, but you're a pretty miserable person that nobody wants to be around.
That's true. That too.
Okay. Well, so if anyone is in
health, but we talked about everything else too.
We talked about a little bit of life. I don't like scripted things. That's what I told you. Like some of my guests want scripted questions. Like I don't do scripted. We talk like this is normal. We're normal. Like I'm not trying to be something I'm not. I'm not trying to be fake. This is real life. Yep. So we end. So I was going to say, if you guys are in Georgia, especially around Atlanta, go find my friend, but definitely follow her on social media. She makes some hilarious, knowledgeable and hilarious reels. I love them. Okay. So if there was so I end my podcast every time with 3 questions. Okay. Yes. So here are the 3 questions. What is the one food that is the most beneficial and why, if you had to pick one food?
So I told you before too, I like grass-fed bison, and I have meal prep in my fridge where I ground grass-fed bison and with vegetables. And I had that prepped for the whole week for lunch this week. I love it. It's got the complete amino acid profile in there, protein, not as fatty, and it's just, you can probably, I love fiber. I get my fiber in, but if I have to choose, it's going to be that. I could eat it every day.
Grass-fed bison. And like I told you, I don't eat a lot of bison. I can't remember the last time I had bison, so I'm going to put that on my mental checklist to try. Okay.
I made grass-fed bison nachos with lots of veggies and beans and all the healthy stuff, and it was so good. Like I made that a couple weeks ago. It was so good, so good. You gotta try that.
Okay. Well, I don't eat cheese, but I could do it with salsa and guacamole.
You could do it without cheese. Yeah, you could do it without cheese. It was make veggies, chopped jalapenos, tomatoes, onions, all that.
I make nachos with carnivore crisp a lot. So I use my carnivore crisp as my chips if I definitely need a bunch of protein.
I have to look that up.
You've never heard of carnivore crisp? No. Oh, they're amazing. It's like a type of beef jerky that it's just grass-fed beef, salt and water. They're out of, I believe, Texas. I get them online, but they have ribeye and different things. They come in these like strips. Okay. And so I eat them as like beef jerky because they don't have any processed crap in them. But sometimes I will lay them down on a plate and put things on top of them like they're nachos. So then you get like double protein. So like on days that I have done terrible about getting my protein, I will do that so I can get like 60 or 70 grams of protein. But anyways, okay. What is one easy health tip anyone can do that's free?
walking.
Yes, I love that. I agree. Walking.
I like 10,000 steps a day. That's my goal.
Yep. Yep.
But I know that when you're walking, you're actually burning fat because your body's not using glucose. It's using fat. It's not, muscle doesn't need to be used as much when you're walking. So you're not going into the sugar stores, going into your fat stores. So I like walking, and it's meditative to me because I go outside in nature and listen to the birds, look at the trees. And that sounds silly, but I do. Or I'll pop on a podcast and listen to Modern Endocrine.
Back to the basics, people.
Back to the basics, and get my steps in. And
yeah,
while I could do like 3 or 4 steps around the neighborhood, like laps around the neighborhood, and I meet my 10K for the day. So
yep,
walking.
Your Aura ring tracks that too, so I agree. And then I walk in the morning to see the sun come up. I would try to walk at lunch with my people. I love that. I make my staff go.
About that.
Yeah. Even though it's 106 degrees in Oklahoma, we go for a walk at Modern Endocrine at lunch. I'm like, let's go, people. And they pretend like they hate it, but now I think they're starting to like it. And then I take a walk. Like as soon as we get off this, I'm going to take my dog for a walk. I take a walk before I go to bed. And it's good for your bones, right? It's going to help keep your bones strong. It's good for your mental psyche. I take my dog. And so you release these like fun, loving endorphins because it's your puppy. And I usually actually see my neighbors, which that's another thing for relationships, right? Like all of my neighbors walk their dog too at night. And so we all kind of talk and chit chat, and it usually turns into a 30-minute ordeal, which is good too, because relationships are the 10th step to ultimate health, as Modern Endocrine does. Yeah. I mean, so relationships and sexual health are really important as well. Okay. What is one thing you wish you would have known about your health 10 years ago?
Oh, what we talked about, like just not sweating the small stuff, just like taking it easy, not being hard on myself, like mental health and stress, knowing that what you said earlier, all of the things that I worried about that were going to happen, that, oh my gosh, this is going to happen, 98.9% of them didn't happen. And so stressing, that's the tip for me. If I could go back, I'd say, hey girl, you're going to make it. All your dreams are going to come true because you have good intentions, and just be calm and relaxed and enjoy the journey, like the right now. That's what I would say. Cause I do that now. Like I have goals for the future, but I'm so present right now. Like I enjoy the present because I know the future is coming, but I want to enjoy the present. So that's what I would say.
You know what, Buket? I think that that's very true. I think you changed my answer to that question. Because I think my answer to that question used to be, I wish I would have known more about just like my diet in general and been a healthier eater.
Yeah.
But 100%, if I could go back and be that little girl at 17 that was heartbroken and just crushed when my counselor was like, you're never going to be a doctor. You can't be a doctor. And just all the doubt that I had in my brain from 17 until, honestly, probably until the last year. Like it all was still kind of there. Like you're not good enough. You're not going to make it. Your dreams will never come true. It is. There's a lot of it that like, it messes with you.
Girl, you don't make me cry.
But it's true. It does. It messes with you until finally you're just like, you know what? Yeah, it's going to be okay. But it does. It's very stressful, and it puts a lot of like just negative, bad juju, and it stresses you out for no reason. Right. Yeah. And so living in the moment and just being grateful for what you have and trusting that what you're doing is, if you're bringing good into the world, you have to trust that the world's going to bring it back to you in the universe. Yep. And I think I finally really, really realized that like earlier this year. And since then, it's just been very freeing. And I started this podcast. I've had all these crazy opportunities that have come at me once I finally just like let it all down and said, you're going to be okay. Like your dreams are going to come true. You're doing what you're supposed to do.
Absolutely. Man, I hope that counselor hears this podcast one day. Like,
yeah.
What?
He was a real asshole.
Oh my gosh. Because
you know what?
I'm an endocrinologist right now.
I'm actually really glad that happened. I've decided in my life that when bad things happen, it's because it needed to happen. It's either to teach you something or to really make you appreciate or teach you like what you don't want to be, or just help you get through it. Right. So I don't know that I would have kept going without that. Like some people say I'm a little hard-headed, I think that's what my father would tell you and probably my husband. And so, that devastated me. But then the more I thought about it, the madder I got. And there were times in med school and in residency where I wanted to quit. It was hard and I was like, I don't want to do this and I want to give up. And, there's been so many times, even in the last few years, it's hard to run a business. It's hard to leave a hospital practice. It's hard to, I made some bad decisions after I left a hospital practice. I had a partner. It didn't go well. We weren't seeing eye to eye. I've moved 4 times, bless my patients. Like I have made some bad partner decisions in life, but that, I don't know, that just kept me going, right? Like that whole, you're not going to make it. And I don't know, but now I'm at a place where I'm like, I think I am going to make it. Everything's going to be okay because I get up every morning and I do what I feel like I'm here to do. And I just want to help people get better and educate them. And I don't know, like earlier this year, I was just like, you know what? Everything's going to be okay. Like you're doing exactly what you're supposed to do. I had all these incidences that kind of happened where, somebody gave me this book and I feel like God showed me something and he just said something to me at this perfect time in my life. And it was very clear. And I just started doing it and I haven't looked back. And I am so grateful for the opportunities that have come and that keep coming, that even came this week, like this summit that I'm going to be on. And then I'm going to host a summit next year. It's crazy. So yeah, once you just let go of that and you're just like, no, you know what? I am good enough and all your dreams are going to come true. It's different. You sleep different. You feel better. You shine more. Right?
The way you're looking, absolutely. Like the way you're looking at it, it's like whatever traumas that you went through, if you overcome it, then you become resilient, right? Like there's stuff that happened me growing up and just in the past, I look back and I'm like, I don't know if I would change it because I truly believe it's made me resilient. Like that's why I don't give up,
Oh yeah.
It's
in bad relationships, no matter whether they're personal or professional, like you learn what you don't want to be or what you don't want to. I know the relationships I don't want to be in. I know the type of people I don't want to be around, and I know what I don't want to be as a professional. And you just look at it like that, and you move on. You live and you learn. And I used to really beat myself up and be angry about it, and now I'm just like, I'm going to just take it and I'm going to move on. Right. And I'm going to do the things that I know I'm good at and I'm supposed to be doing. And all my dreams will eventually come true. They actually already have. Like when you said that, I almost got goosebumps because they already have. I get to wake up every day. I get to go to a space that is called my clinic. And I get to help take care of people who want to be there to see me. Nobody's forced to come and see me. I don't work in a system. You are welcome to find another doctor. But for some reason, every day there are 20 people lined up to see me. And they allow me the opportunity to help them feel better. Yeah. Like, what else in the world could you want? Right?
Like, that's the reason why you went to med school. Like, you went to med school to heal people, to facilitate their journey on this healing, process. And you get to see people truly heal. And that is just,
Yeah. And so, your dreams, like, they've come true, right?
Yeah. Yeah.
So all that stress and all that worry and all that, like, you're not good enough and you're not going to make it. Like once that goes away and you just do you and you put positive vibes out into the world, they return.
And it's
fourfold.
I think your patients see that too. Like they get excited when they see a provider that's excited and wants to help them.
Yeah.
Patients know the providers that care and truly have a passion for it. And that's who they want. And it doesn't matter what it takes, they will come to you. So that's the beauty of that. And I think that's true medicine.
Yeah. Well, and that's why I think you're killing it and doing great too. And our friend Amanda, I love connecting with all these women that are awesome because you're doing the same thing. Like you just want to help take really good care of people. You'll go the extra mile to help them feel better. And that's why you're killing it too. And so I'm excited for you to come and learn ozone with us and keep teaching you all the ways so that you'll keep helping people feel better too. So thank you so much for being on my podcast and teaching me something tonight as well. And I appreciate your time.
Thank you.
Okay. If you guys liked this podcast and you feel like it would be beneficial to anyone, please make sure you share it, like it, leave us a review, and we'll see you next week. The information presented, including any materials discussed, referenced, or linked within this podcast are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems, or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.